So good afternoon, everyone. Welcome to this webinar, the first webinar on inflammatory myopathies within the Reconnect network. And we are very happy to have this webinar with the focus on inflammatory myopathies and physical and social and working activities. Now I will see if I can present my screen. Somehow I can. Oh, okay. Hey. So I'm Ingrid Lundberg. I'm professor of rheumatology working at Karolinska University Hospital in Stockholm, Sweden. And I'm co-chair of the myositis disease group within the Reconnect together with Alain Maillet from Strasbourg. And we are very pleased to have this first webinar on myositis, and it will be presented by Professor Jiri Vencovsky and occupational therapist Hanna Smokrova from the Rheumatology Institute in Prague, Czech Republic. And it was planned that the EPAG, Ilaria Galetti, will also attend. I'm not sure about that. But we will welcome Ilaria if she turns up. So this webinar, for your information, will be recorded and it will be published on the ERN Reconnect's website. And it will also be published on the YouTube channel. So please spread the message for your friends that are not able to attend today. So we will start with having the two presentations from Professor Vencovsky and Dr. Hanna Smokrova. And after that, we will have questions. So please use the Q&A and we will put the questions to the speakers. And questions will be addressed, we will take them after the presentation. So without further ado, I would like to introduce Professor Vencovsky. I'll just see if I can get rid of this. So Jiri, please welcome to this webinar.
Okay, thanks very much for the invitation. Now I will try to share my screen. So, do you see the presentation mode or not?
We see your screen, it looks fine. It's not presentation mode, but we can see the slides perfect.
Okay, so I will have a short introduction into inflammatory myopathies, and Hanna, she will be talking about the actual topic of this webinar, which is the physical and social and working activities. Hanna, she's an expert, she's an occupational therapist. She works in our institution in the Institute of Rheumatology, and she's actually in daily contacts with patients that suffer with inflammatory rheumatic diseases, including those that have myositis. And it is her task daily to teach them how to perform different activities, how to dose them, what should be the intensity of these activities. And she advises them how to be self-sufficient and teaches them various techniques. So she's an expert in it, and I'm very glad we have her in our institution. So I will have a short introduction into the inflammatory myopathies. It's necessary to say it's not one disease, but it's a very heterogeneous disease. And some of the patients that have dermatomyositis are completely different from those who have, for instance, inclusion body myositis, except the muscle weakness that's common. Although patients with dermatomyositis might have only rash and no muscle weakness. So there are different presentations with respect to the myositis and skin disease, but some of these patients may have also organ involvement, particularly lung, heart, esophageal involvement, joints, it means arthritis, and some patients may have calcinosis, which may be very troubling. And some of these 70% of the cases are associated with presence of autoantibodies, and autoantibodies in the serum are strongly associated with the presentation, with the diagnosis and organ involvement. And it's quite important for the diagnostics, and it enables us to predict what would be the further development of the disease. In other words, we predict prognosis. Mostly we treat our patients with pharmacological treatment, glucocorticoids, immunosuppressive drugs.
Excuse me, Jiri, did you change slides?
Yes, I changed the slide.
Can you, because we see still, I still see the first slide.
Sorry. So do you see the second now?
It seems to be, that's the second now, yeah. This is second?
This is this is the first.
Yeah.
This is the second.
Yeah.
Which I talked about.
Yes.
So you didn't see it?
No, but we see it now.
Such a nice slide. I want.
Yes.
But just now we have the possibility to see it. It's perfectly okay.
Yeah.
Okay. So it didn't make sense to look at the first slide and talk about the different manifestations of the disease. Okay, so you can see it now.
Yes.
And so my presentation mode, not only that you cannot see it, you don't see it advance of the slides, but okay. Now you can see the treatment.
Yes. Thank
okay,
you.
Good. So this is the pharmacological. Most of the drugs that we used are off-label. The only approved drug on this table are actually intravenous immunoglobulins that have been approved for treatment of dermatomyositis relatively recently. What is important is physical therapy, which is an integral part of the treatment and is very important because we know that patients with myositis are functionally impaired, either due to the disease, because of the muscle weakness, muscle atrophy, involvement of the lung with interstitial lung disease, or myocardial involvement, it means heart, with arrhythmias, or even congestive heart failure. People may have dysphagia or calcinosis, but there are also functional impairments arising from disease unrelated causes, which means mainly from the treatment, particularly glucocorticoids that can lead to osteoporosis or osteonecrosis. It induces cataracts. Immunosuppressive drug lead to cytopenias and susceptibility to infections. And infections can also arise from the respiratory muscle weakness and dysphagia and so on. And some patients may have malignancy, particularly with dermatomyositis. This is the picture taken from Marianne de Visser publication about 10 years ago, where they followed patients with SF36, which is a questionnaire that follows functional impairment in patients. And the red is baseline, green is normal, and in between blue lines are either after 18 months or 3 years. What happens to patients? So obviously at the beginning they have a very low physical functioning, physical role, mental health, vitality, general health perceptions, and it improves during the treatment. But particularly physical functioning and raw physical, general health perceptions are quite impaired and do not normalize even with the very successful treatment that downregulates the inflammation within the muscles. It's just interesting that social functioning or mental health are not that impaired, and it improves to almost normal level in these patients. So maybe they do something right with that. And just one example, what's possible to do is one of the publications that comes from our institution, from Maja Spiritovic and Michal Tomčík. They looked at the effect of 24-week training, which was focused on activities of daily living, on exercise and muscle strengthening and stability in these patients, and actually quite surprising results to me. Those patients that were trained, so here, this is MMT8, and those were trained in 2 hours in a week. They had supervised training in all these aspects, like the activities of daily living and muscle exercise and strengthening. They improved quite significantly from somewhere 55 to almost 70 in manual muscle tests, whereas those patients who just continued normal treatment and did not do any supervised training even deteriorated during this time. And it was similar with functional index 2, which measures not so much muscle weakness, but muscle endurance. And it was even more apparent, and particularly most of these patients improved by more than 20% in functional in this functional test. And it had also an effect on health assessment questionnaire that also measures functional disability and depression that also improved, whereas increased in those patients who had just a normal way of treatment. What's interesting is this was 24-week treatment, and after that they discontinued this treatment, but they were followed for another 24 weeks, and you can see that they actually started to deteriorate. So it's a continuous treatment that's necessary for these patients, because otherwise they lose the effect during the next 24 weeks or longer time. So we have to pay attention to all these aspects all the time. It's not it is effective for a short period of time, but most of the patients need continuous care in this sense. So this is what I wanted to say as an introduction, and I hand over to Hannah.
Thank you so much for kind introduction and the possibility to be here with all of you. I tried to share my screen. I hope that everybody will able to see it well. Is it
Yes.
okay?
Yes, perfect.
Right. And thank you, Professor Vencovsky, for your introduction. And I will continue with very specific and very important activities which we are doing, all of us, during our lives. And it is physical, social, and also working activities. Oh, I apologize. Yeah. At the beginning, I would like to say that everybody from us are very unique person as an individuality, and we have the original physical and mental state. Everybody from us has different feeling of pain, fatigue. Maybe some people with idiopathic inflammatory myopathies also should have problems with depression, anxiety, or stress. Everybody from us are coming from different environment, and we have completely different social support from our family, friends, or maybe the co-workers from our work. And all of these things together make the differences between every person. And this individuality during not only the occupational therapy, but also the physiotherapy, for example, psychology and all of these things, it is really important to think about these individualities, every person, because we want to manage the original person. And the factors which can affect the performing every activities during the day, it is not only the activities of daily living, it is also the hobbies or the work activities are affecting by the internal and external factors. The internal factors can be the physical and mental factors. From the physical, it can be the original of the disease and maybe the added comorbidities, as was said before. It can be also the pain, the level of the pain and the fatigue. For example, the quality of sleep, the quality of nutrition we have, and also it is in the opposite side, also to the conditioning. In case we will not have the insufficient physical activity, it will be not good for us and also for people with inflammatory myopathies, as was said before, because in last time we have the proof about the effectiveness of physical activity for people with idiopathic inflammatory myopathy. So this is really important part of the intervention. And also we should have the mental factors which can affect our performing. And as I said before, it can be, for example, depression, anxiety, the stress. From my point of view, the stress is one of the biggest reasons why people today are not able very well perform all of these activities. It can be also the poor self-efficacy and the work pressure, for example. And the external factors which can affect the performing these activities is also the social factors, because not every person has enough support from the social work where this person is living. And my personal opinion is that sometimes it is really big problem, the lack of understanding the disease from the family members, the person who is affected by idiopathic inflammatory myopathies. And these people has the habit know that a person with myopathies was able, before the disease start, this person was able to do everything in case it is, for example, the woman. And the woman was able to do household, do every activities connected to care for the children and do all of the work tasks. And when the disease come, this woman, for example, was not so good in performing all of these activities. And it was the big problem for the family when the other members don't want to understand the disease as a whole part of the life of this person. And the next is also the environmental factors which can affect our performing in physical, social, and work activities. And the environmental barriers, as I'm writing here, it is in every corner we can see, it is in every part of our lives, and it is really important to work with these barriers and, for example, the uncomfortable furniture or the typical equipment position, because all of these things we can manage and to make the environment for the people with idiopathic inflammatory myopathies better. And it's crucial to the opposite, remove all of the barriers and set in well the environmental that will be without these barriers. And from my point of view, my experience is that the whole population, it is not only person with idiopathic inflammatory myopathies. It's the other diseases and sometimes maybe the people without the specific disease are doing all of the activities during our lives in a regime of autopilot, because we are not conscious during performing these activities. And the second problem is that we are doing lots of activities in one moment. And these two areas is the big problem these days. And how can we solve this problem? We can, as I said before, we can make the changes in our environment, because we will remove all of the barriers, and also we can use the ergonomics in performing the activities. We can use assistive technology and appropriate product design, which is specifically constructed for people, for example, who have problems with the grip and also with the strength of the muscles. And also we can use the support strategies. And as you can see in these pictures, it is the typical barriers we can see almost everywhere. In the picture left, we can see the small carpet, which have most of people. I'm solving these problems with every person who come to occupational therapy, because people like these small carpets in the house, but it is the potential risk of fall. In case you will not lift your foot enough, it is the possible way when we can fall. So it is really important to remove these small carpets. In the pics in the middle, we can see the stairs, because stairs is everywhere and not in every cases we can remove these stairs. So it is difficult to go upstairs and downstairs for people with inflammatory myopathies. And the third typical barrier is doorstop, because in case you will again not lift your foot enough, it can be problematic. We have also the specific assistive technology, which can make better this situation. We can use these tools for raise the sit up, or we can use, for example, the ad in the right, which is it is specific tool which we can use, for example, when you are not able to put something from the floor. So you can use this prolonged and raised grip, and it's very useful for using in daily basis in case you have this problem. The other typical part, or maybe the room where is increased risk of fall, is our bathroom. So we can use the specific compensation ads in, for example, bathtub, where you can see in the pics in the left. It is a specific compensation ad for sitting, in case you are not the strength muscles to raise up from the bathtub. And the second one, it is, for example, the specific pad which you can put into the bathtub, and it should be the prevention of falls also. And the specific area is our working environment. And most of people today are working on PC. And this is the example how we can use the rules of right ergonomics. It is on the picture in right, where we can see that this is the right position in our table. In the picture in the left, we can see not so good variation how to sit in front of our computers. And when I should speak about the specific techniques we can use for performing activities of daily living and working activities and hobbies. It is the specific support techniques. It is energy conservation techniques, because pain and fatigue is one of the biggest problems for people with idiopathic inflammatory myopathies. So these techniques was created for reducing fatigue and pain. It is the big aim of these techniques. We want to increase the activity tolerance, and later these techniques will help us improve productivity and finally the whole quality of life. The energy conservation techniques has the three main areas, which is really necessary think in advance when we are performing the activities. In case we want to improve our quality of life, it is necessary performing the activities consciously, and it is only way how we can have control about how we perform the activities. So at the beginning, it is the conscious performing of the activities. And we need to support this conscious performing with planning ahead and have enough time to carry out all of the activities we are doing in whole day. And it is really difficult, especially at the beginning, but trust me, it is possible to learn this new thinking, because it finally really helps. When I should give you some example, I always solve with my patients, because I think that Czech people are people who loves gardening, and since spring to autumn they spend many free time in a garden. And for example, after the whole weekend, a person with idiopathic inflammatory myopathies come to my office, and I saw the problems that they have increased the level of pain and fatigue after this weekend. And they were doing lots of activities. They had enough balance between the rest and the activity. And this is exactly the reason why they are so tired, and the quality of life after this weekend was decreased. And I need to learn this person to think in a new way, and this person need to think in these three areas in advance when come again to garden and will do the other activities. So when I will give you some concrete example, when this person come to me after this weekend, and for example, this person has originally the plan that want to visit the doctor, want to do some small shopping and visit the friends in whole day. With the new way of thinking, this person will manage all of the activities during this one concrete day, will manage the activities in different way. For example, this person will not cancel the meeting with the doctor, but can change the weight of the shopping bag. This person will only buy few things and will not have the heavy shopping bag, and will make the health status worse. And maybe this person will meet with the friends only for 1 hour instead of 5 hours. So it means that this person, in context of actual health status, will change all of the activities for one concrete day. And in case this person will learn how to change these activities and have the appropriate planning, this person will finally have the capacity for doing all of the activities, not only this one day, but for the next day. And this is finally the result of these techniques, that this person will have the same level of performing the activities, and there will be not the big differences that at the beginning of the day it will be worse, and at the end of the day it will be more worse at the beginning. So this is really important to think how I will perform all of these activities. And when I should give you some concrete advice, it is really important for people with idiopathic inflammatory myopathies have the balance between activity and work. During the work process, it is also very important to include the regular rest breaks. For example, you will have the activity on your computer and you will work 30 minutes, then you wake up from the chair, you will do some small exercise, or you will drink something, eat something, and after a few minutes, you came back and you can continue your work on your computer. Also, the next point is that it is really important to change the position and not be so long time in one position, as I said just now. We can support these activities using the rules of ergonomics. When you remember depicts the person working on the computer, it is the specific example which we can use. And the other things is also important, the quality of sleep, because enough sleep and enough rest is very good for us. And to the other side, there is important to have some specific cognitive interventions like stress management. We want to decrease the level of stress in our lives, and in case we will plan ahead and we will have enough time for performing the activities, we can reduce the stress, because it is up to us. We not in every situation can change the stress outside our person, but from us, we can change this. It is important to perform the valued activities in our lives, and sometimes it is difficult to manage the disease and also stay in our valued activities. But with the support of the experts like psychologists, or also maybe physiotherapist and occupational therapist, we can set appropriate goals for activities for the concrete person. And as Professor Vencovsky said before, it is really important, the physical interventions, the regular physical activity and exercise, because it really has the good impact for our health status. So the combination, all of these techniques can support people with idiopathic inflammatory myopathies do the best for performing all of the activities during the life. And when I want to mention the most important thing from my side, I think it is the 3 areas of thinking when we will do the activities during our whole day, and it is the conscious performing activities. We need to have enough time for doing these activities and planning ahead in connection for our actual health status in one concrete day and the next days also. And thank you so much.
Thank you, Hanna, for this very important discussion information, and thank you also to Jiri for the introductory talk on the inflammatory myopathies. We have now time for discussion, so you can write your questions in the Q&A or the chat box, and I will read it, and we will discuss with our speakers. But maybe I can start while we are waiting for some comments and ask Hanna, do you meet all myositis patients when they are newly diagnosed, or how is that organized in your institute?
I'm not sure if I'm able to meet every new person with idiopathic inflammatory myopathies, but after the prescription from our rheumatologist or also our rehabilitation doctor, after this prescription, I'm able to visit the patients. So at the beginning, I need to impulse from our doctors to see these patients.
Mm.
I am working in inpatients and outpatients, and definitely these people are coming to my occupational therapy appointment. Yes.
Do you also
I
have the
think
possibility to follow the patients, or do you see them once?
Yes, I have the possibility to follow, because from my point of view, it is necessary to have the information from our patients if the treatment or intervention is useful. So definitely it is very important to see again the people, and I try to manage the quality of life of the people, and because the disease can change, definitely the goals and aims of the therapy are changing in contexts of actual health status and status of the disease. Yes.
Jiri, did you have a comment?
Well, I just wanted to comment that at least those patients that are hospitalized in our institution, I think all of them are seen by Hannah, because when they are hospitalized. Of course, it's impossible to send all of our patients to her, because I think we have several hundreds of them. It wouldn't be possible.
I will come back, but first we have a question. Do we have any data on the burden of IIM on the caregivers? If not, what is the opinion of the panelists? Do we have any data on caregivers? I would assume that is like the family, or?
I think it was mentioned like the very close family members, but it can maybe the colleagues, for example, from work. It's not always focused on family members, but I am not sure if we have the exact data. But from my point of view, and sometimes I am cooperate with the family members usually, if it is necessary, because as I described the example before, it was the lady which does not have enough support from the family. In case I feel that it is necessary to invite the family members or friends or co-workers, I think it's great and important to invite these people, because in case I will explain how it is really important to support this person. And for example, I will share or show the ways how to manage, for example, the house or the flat, how to remove the barriers, and how to help this person with idiopathic inflammatory myopathies. I think it is definitely very important to cooperate with family members, because we as formal carers spend very few time with our patients, but definitely it is the family and friends who spend the whole time with our patients, and this is from my side the reason why there is definitely very important to support the informal carers of people with idiopathic inflammatory myopathies.
I completely agree with you, Hannah. We have another question or comment here. Thank you for a nice and very enthusiastic presentation. Do you recommend this counseling on energy for every patient, or only for patients having problems with fatigue and energy loss? And at which state of the disease do you recommend this counseling? At the beginning, in the active disease state, or later in the more chronic stage?
Thank you for a very clever question. And I think that these energy conservation techniques is useful for every person in every stage of the disease. in case we start earlier, it is better for the person. But in case, for example, come to me person which has the worst status of the disease, it is important to educate this person at the beginning. But in the general, in case, potentially when the person come to me early, definitely at the beginning of the intervention, I discuss these techniques with my patients because it is really important they have this information. Because, for example, when I only recommend, for example, the compensation aids, and I will not discuss with my patients not removing the barriers or adapt the house and flat and workplace and all of these things, it will be not not fully appropriate the information, the intervention. Is it understandable?
Yes, thank you. Very nice. Thank you. Very excellent response.
Yeah. Thank you.
As it was Dr. Ipipetu asked, and so another question or observation maybe from the OMERAC work is that actually from the patient's perspective, the fatigue is one of the dominant symptoms, and which may have been under-recognized in patients with myositis. Do you have any outcome measure that you used for fatigue or physical activity that you used to follow in your clinic?
Personally, I'm not using these specific tools how to measure, but maybe it will be fine for us because I have the experience that usually it is using in some research activities, but I'm not sure if it is using in daily basis for our patients. But I am always asking my patients if the advice about how to solve this fatigue and pain and for example, also exist the specific techniques for joints also. So I'm always asking if it is useful for my patients, and maybe sometimes it is for me the more important information than the specific questionnaire. But I think it's the both of these forms are definitely important, but I'm not personally using this specific questionnaires.
May I ask, Jiri, do you use any of those like patient-reported outcome measures in your daily practice, in your clinic?
Well, in daily practice, I wouldn't say so, actually. We do it for patients who are in the clinical studies, who are followed not only for the treatment, but also from the research purposes, of course. That we don't do it on a regular basis every visit. No, it would be too demanding, I'm afraid, So what I do from time to time when I need to write some reports for the authorities or something like this, we do the hack. Usually I use it, maybe it's SF36. For patients who are in the register, they fill in SF36 at the beginning when we see them and after 1 year. But this is for the future research purpose. We don't do it. We don't use it in as I say in the clinic. I don't look at it when I see this patient, which is probably a mistake. Yeah, it's probably wrong.
I think we do the same, but maybe this is something to discuss with our EPAGs on the myositis group. If there is a questionnaire or a prompt that the patient would favor, that we should use in different centers. I mean, what the patients feel is important. So I think that's linked to what Hanna has told us then.
Maybe if I can have one more comment, I think that sometimes in the field of rheumatology, it's quite difficult to have the objective data on the performance of people in all of kind of activities, because as everybody from us know, when come to us person at the morning on Monday, and in case this person will come to us on morning afternoon, the health status will be probably different, and the health status is probably different on Monday and on Tuesday. So here is really difficulties, and I am not always able to imagine how we can have in 100% objective data, because the health status is changing really in a big way.
Yes,
Yeah.
of course, many factors that influence how you are feeling or the perception of health from maybe one day or one morning to the afternoon. I completely agree. We have Olga Drapalova has sends her best regards. Thank you very much, Anna and Professor Vencovsky, for this webinar. It is very important for all patients with myositis. So we'll see if we don't have any more questions. I will check the Q&A. We have done that. We have the chat. But I think then I would like to, do you have any more comments, Hannah or Jiri, that you want to take the opportunity to express here?
Not me. No.
Maybe finally I will have from my side the last word, that I would like to say that it is really important to support all of our patients with idiopathic inflammatory myopathies, and also, as we discussed before, their informal carers. And I think that really big support for us, I mean the formal and informal carers, are also patient organizations. And I'm very happy that across the Europe, all the whole world, there is very tight cooperation between all of the three pillars. And I'm very happy for this cooperation, because with this cooperation we can make the life our patients better. Yes.
Thank you, Hannah, for these very wise words. And I think that is one of the messages we want to lift in the Reconnect, that we really want to improve the life of our patients, and that we can all do this by collaborating. I see we had, yeah, there was also one comment here. Thank you for the nice seminar. We should do the same topic also in the other diseases in Reconnect. So you had an excellent evaluation here. And please tell your patients that this can be, you can listen to this, watch this on YouTube, and go into the Reconnect website to find it. So this was the first, and I think I'd like to thank you both for your excellent contributions. We will have a second webinar on myositis in June. I just have to check the date. It's the 14th, Wednesday, 14th of June, and it will be on, as far as I remember, more on the disease phenotypes, on skin rash, and we are open for new topics for the webinars for myositis that we will have in the fall. So if you are listening here, please send us a message and come up with suggestions for topics that you would like us to discuss through a webinar like this. And with this, I thank you, everyone who has attended. Everyone who has attended today, thank you for your contribution and discussion, and thank you, Hannah and Jiri. And with this, I wish you a nice evening. Yeah. Bye-bye. Bye-bye.
Thank you for inviting. Bye-bye.
Okay, thanks very much.